A very good evening and a warm welcome to all our viewers. Today's lecture is the posture papers, understanding of the influence of posture on the spine. So, sedentary behavior is a growing global health concern. Sitting for a long period can lead to increased muscle stiffness, fatigue, discomfort, and even low back pain. This necessitates questioning the negative consequences associated with an unfavorable sitting posture and a low level of postural activity. To learn more about this topic, we have with us Dr. Ken Hansraj, Dr. Naresh Babu, and Dr. Ashok Gupta. We also have Dr. Samir Dalvi, who will be joining us shortly. Doing a round of speaker introductions here. We have with us Dr. Ken Hansraj. Welcome, sir. He's a spine surgeon at the Northern Medical Group Spine Center in New York. He is a spinal and orthopedic surgeon with more than 20 years of experience focusing on the whole body and preventive care. He's also specialized in spine surgery using minimally invasive approaches and has also developed a breakthrough strategy using stem cells for failed spinal surgeries. Dr. Hansraj was named as one of the America's most compassionate doctors in 2020 and is frequently rated as one of the New York's top doctors as well. He has released the Watch Your Back 9 Proven Strategies to Reduce Neck and Back Pain Without Surgery book as well. So, welcome, sir.
Thank
Our
you.
next speaker is Dr. Naresh Babu. He is the first national board certified spine surgeon of Andhra Pradesh. He is the director and chief spine surgeon at Malika Spine Center in Guntur, and his expertise is in the degenerative spine, spinal infections, spinal deformity, craniovertebral pathologies, etc. He's also received the Nilofer Chinoy Award, the Consultant Gold Medals by Oasis, and the VT Ingallikar Gold Medal by the Association of Spine Surgeons of India. Um, Also, the E.T. Raju Gold Medal by INTR University for the Best Outgoing Orthopedic and Meno Fellowships and Research Awards as well. Pleasure to have you with us here, sir. Welcome.
Thank you.
We would also have Dr. Samir Dalvi here with us, who's a consultant spine surgeon at PD Hinduja Hospital and Breach Candy Hospital in Mumbai. He's specialized in the field of orthopedics and spine surgery, and his fields of interest are microsurgery, microdiscectomy, minimal invasive surgery, etc. And I would now hand the mic to Dr. Ashok Gupta, who is the professor and at the Department of Plastic and Reconstructive Surgery at BEAMS in Mumbai. He is a renowned reconstructive plastic surgeon with more than 35 years of experience, has been conferred with the Padma Shri by the President of India as well. It's also won many other prestigious awards, including the Sheikh Hamdan bin Rashid Al Maktoum International Award in 2010, the Queen Victoria Commemoration Award in 2015, and the Goosey Peace Prize International and the Lifetime Achievement Award on Health and Philanthropy in 2015. Dr. Gupta also holds expertise in body contouring, facial contouring, breast augmentation, etc. And is a founding member of several international professional organizations like the World Society for Reconstructive Microsurgery and the American Society for Reconstructive Transplantation. Um, Handing over the mic to Dr. Ashok Gupta now. Over to you, sir.
Thank you, Darshika. Thank you very much. Indeed, it's a pleasure, great pleasure and honor for me to be part of this very important topic of mind your posture, mind your back. It is a common problem faced by practically everyone, every surgical field, every physician, every professional during his lifetime. It is either because of the professional need or because of wrong postures. Almost 90% of the back pain problem is correctable by without surgery. I would not say with authenticity because I'm not a spine surgeon, but most of the spine surgeons with whom I have interacted, they say 90% of the problem can be corrected by correction of posture, correction of the habits and non-invasive procedures. So I think it's a very, very important topic for the doctor practice to pick up. Very important, informative topic for all of us to understand this happens with everyone. I being a microsurgeon, work under microscope for hours together, sometimes up to 18 hours. And then we have a stiff back, we have a stiff neck, we have a stiff hands because we have to work in a one position without moving the hand and shoulder. So all this stiffness, I would request Dr. Ken Hansraj also, before he talks about the postural correction, what measures a surgeon or a professional should take uh, during or before or after these procedures, which are 6 hours, 8 hours, or even 10, 20 hours long, to protect the back and protect the stiffness of the neck and stiffness of the joint. It's a common problem. People have ulnar nerve compression at the elbow. People have wrist problem. People have stiffness of the neck, and which can be prevented. And I think is a very very important topic. And I indeed thank you, Dr. To Shithil, for allowing me to introduce Dr. Ken Hansraj and Naresh Babu and this topic, and they have willingly accepted this topic. And I will request Dr. Ken Hansraj to start with the explanation what manners and maneuvers we should do to prevent stiffness of the neck and back. Thank you very much. Welcome, Dr. Ken.
Thank you, Dr. Ashok. It's such a pleasure to be your friend. Thank you for sponsoring this. I'd like to start with a little bit of gratitude. Um, when I was a student, I worked with the greatest Indian surgeon, Dr. Chitranjan Ranawat, who invented the knee replacement for mankind. And he was the most amazing mentor on the planet. And it's from him that I saw the vision of doing three-dimensional assessments, because I did it with him. And many years later, I created my own model. I'd like to thank my engineers, Joros Rozic in Slovenia and Bogdan Firtat in Romania. These guys are brilliant, brilliant men. I asked them questions that have never been asked, and they answer it with the highest level of mathematics, as you will see. And of course, I'd like to thank my best friend, Richard Rubenstein, and my bestest friend, Shay Pantano. Richard and Shay have taken my message globally. So these studies have been shown on every single television channel on the planet, or almost there, with a combined media presence of 12 billion. And that's thanks to Richard and Shay, no doubt. And there are many, many others that, and I'd like to thank my wife for tolerating all the nonsense I do on my spare time, which you will see now. Okay, so I will cut to now the talk and my part of this talk. Okay, it's really a great pleasure to present to you on something near and dear to my heart, which I call the posture papers. And then subsequently, Dr. Naresh Babu, I was so excited that he created, instead of a posture on the neck, the surgeon's posture on the neck. And boy, I reached out to him and I summarized his paper, and it's certainly nice to be his friend. And certainly I'm happy to collaborate with Dr. Samir Dalvi. I've been sending him patients in Mumbai from New York, and it's nice to get to know him here. And so what happened was the original story. I saw a patient in maybe 2013, and I decompressed his L5S1, I think on the right, and his right-sided leg pain went away instantly. And so he was a laborer, and we were friends. And so I put him through a protocol called lumbar stabilization to strengthen his back progressively and incrementally in preparation to get him back to work. Now, my patient, his leg pain went away instantaneously, just like Dr. Babu and Dalvi's. They know these results, and we're very thankful for these kind of work. We helped him walk again. And so, but then there was a problem. He developed, at about 5-6 weeks or so, he developed tremendous neck pain and back pain. And so I scanned him in his neck and scanned him in his back, and our surgery was okay, and his neck was fine. And I couldn't understand why he would have such severe pain. And certainly I couldn't send him back to work. So 4 months later, he explained to me that he was playing Angry Birds, a video game, most of the day, heads down like this, 90 degrees down on his iPad or his phone, one of his smart devices. And so then I got interested in posture. And so we got him trained by the physical therapist. And in training, he was cleared and went back to work. And now he's another patient that we did surgery on, like Dr. Babu would tell you, and Dr. Dalvi would tell you, and we never hear from them again. But his incursion of the neck pain started me thinking of posture and the importance of posture. So I'm an academically trained surgeon, and I did a lot of academic studies like survivorship assessments of surgery, but I stopped doing those papers because they sit in our libraries and clinical orthopedics and all those great journals and that sit around the libraries around the planet. I didn't think that they were helping people, so I stopped doing those studies. And so I remember when I worked with Dr. Ranawat, and he did the geometry, the proximal femoral geometry study, three-dimensional study. And so I started my own model of placing a spine in a computer. And so, we have a surprise for you before we start. So we'll ask this provocative question. So who was the first defined spine surgeon in our textbooks? And so I'll give you the answer to that. It takes some doing. That's the answer, but hold on. I need to get to my video, so I'll stop share for a moment.
Sure, sir. No issues. So your screen is still visible?
Yeah, that's okay. All right, here we go. I just, this is all kind of new to me, so here we go. I'll share with you the provocative answer. You can see that?
Yeah.
Okay. Okay. So, according to our textbooks, Lord Krishna was the first spine care provider, the first surgeon, so to speak. And certainly, according to our textbook, Jesus Christ was also a spine care provider. He came along, I believe, 5,000 years later, and he classically straightened the spine of one of his devotees. And Lord Krishna used traction and forces, while Jesus Christ used touch. And certainly, Muhammad is credited for doing all of the worshipings that they do, prostrating themselves 5 times a day. That is so healthy for the spine. So Lord Krishna was first, Jesus Christ was second, and certainly Muhammad is credited with his spine care work. Okay, let's go to work now. That was my surprise start. So we did coming back to the study of the neck, the text neck study. We did a study which was subsequently published called Assessment of Stresses in the Cervical Spine caused by posture and position of the head. And to do this study, we took, we bought the model of where they took a spine and they took pictures and they photographed it digitally and with great care to the precision of 0.1 millimeter. And so they defined the spine, and I'll show you some of that. And so this digital defining of the spine is quite beautiful, as you see. These are the bones of the chest, of the scapula, the pelvis, and these are the bones of the vertebra. And these models are precise too. When a millimeter is a pencil dot, they're precise to 1/10 of a millimeter. They're absolutely precise. And the software used to run these assessments is the same kind of software you would use to build a space rocket or a sports car or a regular car. And so here's another image of defining the ligaments of the spine, the ligaments that run between the transverse process and the supraspinous ligaments. As you can see, this is all setting up the model. When we layer in the muscles of the abdomen, it becomes really beautiful and very real. You can start to get a feeling that you have this tremendous mathematical model, which is uber precise to work with and to play with. And here's some more muscle definitions of the spine. Look at this disc geometry. This is the digital representation of the disc. Certainly you have the annulus, and then you have the nucleus. But you get the feeling that this is really precise. This is beautiful work. It's amazing. And my engineers have told me, you ask us to answer questions that have never been answered before. And we go to work and they create these amazing answers. Here's a beautiful vertebral body. And you can see all the matrix, I think they're called matrix or matrices. And you can see the lines defining in and out the vertebral body. Again, talking about the precision of the model. Okay, so we loaded a spine into a computer and we used the finite element assessments, and the weight of a head is usually 10 pounds. And so this first study we did, we found that the head at 15 degrees exerts 27 pounds of force to the neck. And then the head at 30 degrees exerts 40 pounds of force to the neck. And the head at 45 degrees exerts about 50 pounds of force to the neck. And then the head at 60 degrees exerts 60 pounds of force. So then something amazing happened. Now remember, I started as an academic surgeon trained by some of the greatest names on the planet in terms of academic surgeons. And we created a model. And then so what happened was CBS News broke the story. And then what happened was amazing. The story broke in waves across the world. It seems that there are gurus, so to speak, in each quadrant of the world, and they're waiting for good stories, and then they just allow it to be carried widely. So, for example, ABC News, which is the Australian Broadcasting Corporation, they called me, they interviewed me for 10 minutes, and they carried the story to every single television station, every single radio station, every single newspaper in Australia and New Zealand. And similarly, all the Times of India carried stories, and all over the world, the Iranian Times, Singapore Times, and of course, the New York Times and LA Times and the London Times, and everybody carried it. And we were feeling great. We were, wow, we're the men. We did a study that's helping the world. And then this happened. So, for example, I got a call from Der Spiegel in Germany, and they said, we like your study, but to be scientifically precise, we're going to restudy your study. And then, so we said, oh, uh-oh, I hope it's good. And so they restudied the study, and I got to tell you, we were afraid, but almost the Washington University in Barnes, Portugal and India, they were all teams that restudied the study, and we got validated globally. I'm happy to tell you that everybody agreed with our assessments, and the story by this time went from 4 billion to 6 billion views across the planet. And I believe that we helped humanity. I really do. And so to reiterate these findings, at 0 degrees, the head weighs 10 to 12 pounds. At 15 degrees, it's 27 pounds. At 30 degrees, 40. 45 degrees, 50 pounds. And 60 degrees, 60 pounds. And so that's the story of TextNet. The models are so precise that it tells us exactly where the forces land. So in the TextNet model, you have really a thoracic exacerbation of forces, the thoracolumbar junction and also the lumbosacral junction. You can see exactly where the forces are. And so I'm not going to play this, but this is a video of how this went global and how you can find it on YouTube and all the television stations that carried it. Okay, but then the question is, what do we do with this data, right? What do we do with this amazing data? First, we did something that I call flash awareness. We were able to help people everywhere with flash awareness to become aware of what happens when your head is straight and what happens when you lean forward with your neck and all the stresses you place on your neck. And so people everywhere became aware that they need to keep their head up, right? So the common answer, the level 1 answer is, always watch where your head is in space. And so I had performed an interview with the great guru, Sri Sri Ravi Shankar, and he pointed out to me an amazing strategy, simple strategy, which I've used and incorporated into my message. And he pointed out that your eyeballs have range of motion too. So you can look up or look down. And he pointed out that posture is first looking at someone's eyes, and you can tell if they're happy or unhappy depending on the way they're looking up or down. So certainly with that in place, if you look at the study, then you say you should keep your cell phone straight in front of your face, but you don't have to. You can keep your head up, keep your cell phone down, and look down with your eyeballs, right? And so now the eyeballs have range of motion. And so let's talk about defining proper posture. Proper posture is your ears above your shoulders and your angel wings back. So proper posture is sort of like, it's a metaphorical string. It's like someone has a string that's pulling you straight up. And so you stand tall. And it's like you're standing out of your shoe, but you don't elevate out of the shoe. My message is, when you're embracing good posture, is not to be rigid. You do not want to be in proper posture like a British soldier guarding the Queen, they're rigidly into proper posture. Rigid proper posture is painful and is not good for you. And so you want to embrace proper posture, stand tall, bring your shoulders back, but softly and lightly, and enjoy it. So we created, after 20 years of work, it came to me a stretch That's called the supination external rotation stretch. And the fastest way to get into proper posture is to, if you drop your hands in front of you and you supinate. So if you're a surgeon, you go, of course, I know what supination is. And if you're not a surgeon, you go, what is supination? It's going for soup with your hands. You open your palms. So you drop your hands and you supinate. And when you do, you'll find it's easy to open the chest. So you supinate and you open the chest, you close down the scapula, or so it's supination or external rotation of the chest. And that's really, that's helped so many people to get into good posture and to stay in good posture. Most recently, I wrote a book called Watch Your Back, 9 Proven Strategies to Reduce Neck and Back Pain Without Surgery. And we have umpteen stretches that we define, but for this presentation, I want to show you one great posture stretch, which is the wall angel stretch. So you stand next to a wall and you step off about 6 inches and you tilt your pelvis into your belly, right? So you tuck your pelvis into your belly, then you bring your arms out, and then you do the wall angel stretch. You just bring it straight up and straight back and compress your scapula. It's one of the most beautiful things you could do. You're working your trapezius, you're working your shoulders, and it feels great. Get to know the wall angels, the wall angel stretch, and there are many other stretches. So being cognizant to bring Dr. Babu on and Dr. Salvi, I'm going to try to move quickly for you. And so I talked to you about standing straight up, talked to you about your eyeballs having range of motion. I talked to you about proper posture, which is standing straight up, shoulders back. We talked about my supination external rotation maneuver, go for soup, open the chest, and the wall angels. And that's really, that's a real nice expose on achieving proper posture daily. Now, when we did the TextNeck study, quite honestly, when we got restudied globally and we passed each test, it was scary. I'm not a major academic center. I mean, this is a private endeavor. And so first it was scary, and then we got really confident that we have an amazing model in the spine. And so then we started doing other studies. So we did the backpack forces on the spine study. And so again, you could see precisely where we loaded the spine. This is an image out of the paper, and they asked us to define where the backpack was loaded. And so the backpack was loaded from T1 through T8. And this is a sub-millimeter definitions of stresses. So then we found every pound you put in a backpack weighs 7 pounds of force to the spine. And then if you lean forward, it weighs 11.6 or 12 times the force. If you lean forward 20 degrees. So an Indian soldier working in the Himalayas carrying 100 pounds on a backpack, if he's standing straight up in proper posture, the stress on his spine is 720 pounds. And if he's tired and he's leaning forward 20 degrees, then it's about 1,200 pounds, specifically 1,163 pounds of force. This study also went global. CBS News sent in a team, and they broke the story, and they broke the story, and they broke the story. What I'm trying to tell you is they sent in a team, and every single CBS channel, like CBS New York, CBS LA, CBS Connecticut, they all broke independent stories nationally on one day. They really liked this study. And ABC News did another study that went global on these results. In those discussions, all of the discussion, it's overwhelming the amount of spine forces that our kids carry when they're carrying books, for example. Every book you carry weighs 7 books to the spine, or 12 books when you lean forward. And so an American kid could carry 30, 40, 50 pounds per day. And so there was a lot of thinking and soul searching. And so based on all the other papers, suggested safety level was carrying no more than 10% of the body weight of a child or a person in a backpack. And so this is another one of our posture-related studies. And so here's a study that made my wife cringe. So we gained more confidence, and Dr. Gupta, I'm sure, with his plastic surgery realm, would take great care in observing the data on this. And so we endeavored to study breast forces on the spine. And so we studied, to do this study, to do the breast force study, it would seem pretty complicated, but it wasn't. It was really easy for us. The mass of each commercial available breast size is published. It's published data. And so my team, they took the mass of each breast and applied it to the finite model, and they created the force that each breast generates, and then the force that each breast size generates at 20 degrees. So for example, if you're 36C, in proper posture, your breast exerting 23 pounds of force. And if you lean forward 20 degrees, then the breasts are exerting 32 pounds of force. And certainly if you're 36N, the standing straight, the breasts are exerting 110 pounds forces of spine and on the spine. And if you look at it in terms of forces by bowling ball, and a bowling ball weighs 12 pounds, it's about almost 10 bowling balls of force. And when you lean forward, then at 20 degrees, 154 pounds of force, or 12 or 13 bowling balls of force. And it would be interesting to get a comment from Dr. Gupta in regards to these studies. That's my main presentation. And so that's where I am.
Thank you, Dr. Ken, for such a wonderful presentation. And I entirely agree that the weight of the breast, we have also studied in our specialty, the weight of the breast can lead to a lot of backache problem, lot of shoulder stiffness, lot of neck stiffness. But we did not have the scientific study, the way you had done about the straight posture and leaning forward. I think this will be a very good point we need to add into our study also, about the size of the breast and the posture, and we can correct number of issues of the shoulder and the backache with the heavy breasted ladies with the posture correction. Of course, surgery is one of the options for them to reduce the size, but that does not help them getting the back pain and the postural correction, back pain and the shoulder stiffness. I think is a wonderful idea. I think now this paper is open for discussion. We had some of the question. Shall we take those questions before, or would Dr. Naresh Babu would like to add to the presentation and then we take on questions?
So either way is fine, sir. If you want to take questions, it's fine.
No, you add some of the points which you feel have been missing in, so then we can go ahead with the question answer.
It's a very fascinating study. The name itself, I think we have to congratulate Dr. Ken for coining the term, the text neck syndrome. So when we initially heard about this thing as a public, it's like a public health awareness campaign rather than something related to spine per se. And then by that way you address the syndrome as a text neck, it indicates how bad is texting and keeping the neck posture in flexion, and then it's easy for the patients also to get communicated. I think you have taken it forward and also suggested remedies for the text neck syndrome, and also I think you studied the neck with the text neck, and then thoracic with the backpack and the breast. And think for Indians, you need to do some of the lumbar spine for the tummy or belly. Maybe your next topic, like you study the breast weight, maybe it's worthwhile studying the added abdomen weight for the future back pain. I think that.
We
Yeah,
we
please.
just did that study, and I'll be presenting that later. It's just done. It's just out. And just to answer your question, it'll come up in later in the presentation. Belly fat forces on the spine. Thank you.
Okay, perfect. Yeah, I think you can take some few questions from the.
Yeah, there are some questions from the audience which have been shared. Darshika, would you like to address those questions? Dr. Gyanendra Mohan has said posture issues among senior citizens. Now, would you like to address Dr. Ken or Naresh Babu? What should be the...
Yeah, Ken first.
No, Naresh first. You go first.
The postural neck problems of the senior citizens, I think it's not only the senior citizens, anybody. I think it has no age limitations. That posture is something which we need to build up into mindset from the very early in our lifetimes. And then, but few postural issues are very quite common with the aging process. Like usually, I think aging is a kyphogenic event. We slowly tend to kyphose ourselves, and our cervical spine gets straightened up, and also the lumbar spine gets the altered mechanics. We need to adapt to that the new posture which the age pushes us to go into, and also the muscular uh, tone or muscular strength which gets reduced over a period of time. We tend to lean forward or stoop forward and bend forward. But I think that our age-old tradition of doing regular yoga or some kind of Surya Namaskaras or the traditional way of keeping yourself fit and then perfect asanas for the neck is the one which I think that is the. I think our ancestors have thought long back about the importance of posture, and we also did a few small studies, and we are somehow got interested into this yoga and the posture of the spine. When we studied the posture of the spine, when the patient is in Vajrasana, that's where you bend your knees and then ankles and then try to sit up. That is the perfect sagittal profile is recreated in Vajrasana. And we took some X-rays and then try to analyze how the spine is getting adjusted. If you're sitting in a Vajrasana, whatever way you try to maintain, you can't deviate from the natural cervical lordosis, thoracic kyphosis, and lumbar lordosis. It recreates the spine. I think best way to avoid these things in the elderly age group is to start early for maintaining the posture and be conscious about keeping the posture. Whatever the work you do and ergonomics during the workplace, and also the few muscular strengthening exercises over a period of time. Over to Ken. I think he can add up because he's done a lot of
Yes, Ken.
work on this. Yeah.
I have one more question before you, before
Yeah,
you take on.
Please.
These belts, cervical belts and lumbar belts, are they a substitute for a good postural training?
Lumbar belts, sir.
Yeah, many of the people wear a belt to support their lumbar spine and the neck, cervical collar. And I personally feel they are of no use. It's just a precaution for person that something is wrong with their spine and back. But it does not prevent. I mean, I don't know whether it is really useful or not.
It's in my perspective, it's like a double-edged things. Like when you have severe muscular pain, either in the neck or back, if you have cervical collar or lumbar corset for a shorter period of time, that will give you a temporary relief for the back pain. But if you continue to use the belt, either in a cervical spine or in a lumbar spine, our paraspinal muscles on the neck or in the back, they tend to go into disuse atrophy. If you're fixing the spine for a longer time and using the belt and not allowing the spine to move, usually the muscle tends to
Yes.
twist, and then you are used to that belt again and again. It's like having a watch. If you lose the watch, then you feel like something is missing in your hand. Same thing, like if you used to the belt, if you take off the belt, then you patients used to complain that I am comfortable with the belt. Instead, if you can tone up your muscles of the lower back or the neck, the muscles itself, they act as a
Yes.
natural belt for the spine, and they maintain the posture.
Yeah.
Yes, it can be used for a shorter time for acute pain to soothe the pain, but
Yes.
those are few indications in the spine where there is a instability in the spine, where the spine is very loose. Maybe you can use it for a little prolonged time while doing the work, but it's not suggestible to continue it for a longer period of time.
Thank you. Dr. Kane, your comments now. Your for
So
citizen, special instruction for senior citizen for posture, and then the use of belt.
so just like Naresh, I also have a deep interest in how the spine ages. And so in my latest book, Watch Your Back, we did a whole section on, we modeled out how the spine ages. So we have a spine at 25, at 35, at 45, at 65, at 75, and at 95, or somewhere there. And we even defined, we took positions for 105. And so we're used, as spine surgeons, we're used to looking at MRI scans all day with sagittal profiles. So we're used to looking, we get a feeling for this data. And so most of us in our youth, a youth defined up to 45, the spine maintains its alignment. The cervical spine has a belly shape, the thoracic spine has a reverse belly shape, and the lumbar spine has a belly shape again. And so the spine does not really deform much in our youth up to 55 or even 65, so to speak. But that's not the case. When at 28 or 30 or so, our bone mass starts to decline. So even though the spine maintains its curvature, the bone quality is weakening. And so then when you start to look at age 75 and 85 and 95 and definitely 105, it becomes exaggerated fast. The thoracic curvature becomes more pronounced, and the lumbar curvature becomes larger and more pronounced. And then at the level of the hip joints, the person flexes forward to stand straight, and they become shorter. And at the level of the knee joints, the person flexes the knee joint and they become shorter, and the head pitches forward, all the while the spine is degenerating, giving problems like osteopenia or weakened bones, or you can have fractures, microfractures or real fractures, or developing stenosis or developing herniations. And so the big takeaway is, as you get older, the curvatures become bigger sways, bigger curvatures. And to protect yourself, it's just as Dr. Babu stated, do what our ancestors say, do these Surya Namaskar daily, or certainly embrace spinal suppleness and spinal strengthening from a young age, so that you maintain good posture and you maintain good strength, and that you age gracefully. That's my answer on the older person protecting their spine.
Thank you. Now we move to the second question which has been posted. Uh, who is more prone to low back pain, office worker or a professional divers? Worker, I would say, because of sitting for a long period, and driver sometime with a jerk and with a motion. Does jerk and motion add to the incidence of high back pain, or it is only the posture which is primarily accountable?
So I'll go first this time. So I'm sure same with Dr. Babu is these are questions that are near and dear to our hearts, right? So to give proper credit, it was Tim Cook who called out that sitting is a disease, or sitting is the equivalent of smoking, and smoking is certainly equivalent to cancer and heart disease, and sitting is a problem. And certainly we need to credit Tim Cook for that assessment. Here comes Samir. And so, hi, Samir. Welcome. And so with sitting, the recommendation actually generated by Tim Cook, who's not a doctor in himself and very brilliantly recommended, was to get up and stretch for 1 hour. I'm once in an hour, every hour you should get up and stretch. And so I say, and in my new book, we show that, let's say, if you say, look, I'm not getting up every hour, then in your sitting position, you can do 20 stretches. You could do something in your seat. You could do flexion, extension, look left, look right. You can do exaggerate your belly like the cow and exaggerate your back like the cat. You could do a cat-cow stretch. You could stretch out your hamstrings. You could do deep belly breathing. You can do all these things in a sitting position. Now, when you use the example of a cab driver, I believe is what you said, he's facing the same sitting disease, but perhaps an even more painful example is the FedEx or DHL delivery guy who is lifting all day, and they can certainly lift 1,000 pounds or 4,000 pounds, which is up to even 1,000,000 pounds a year. And they need to really protect themselves with proper posture and strengthening.
No, one of the question which I feel is also important is the vibration and the motion which truck drivers or automobile drivers are subjected over and above long sitting position. So my question is, does the vibration and does the motion adds to the backache problem for an office worker sitting for 6 hours, a surgeon sitting for 8 hours, and a cab driver or a automobile driver sitting for 8 hours and performing duty? Does the motion and vibration add to the problems?
Certainly, it's well recognized that vibration is a cause of spine breakdown and certainly pain.
So I think this is also very, very important thing. Vibration is a cause for many other problems. And as a surgeon, I know that whenever you use the drill machines which are vibrating, there is high incidence of the deference contracture and even the shoulder muscle fatigue with that. So vibration is there. Now welcome Samir. Dr. Samir, are you there?
Yeah, very much. Thank you. And I'm really sorry, but one of my surgeries ran over. So,
any comments from you on the professional drivers and office workers backache problem in your experience?
So yes, I think one of the things which I'm sure it's covered. I joined in late, so I apologize. But I think back pain is really ubiquitous across all professions. So sedentary workers have it, and very heavy laborers have it. Surgeons have it, and sweepers have it. So I don't think back pain really spares anyone. But to come to this question of, one interesting thing which I noted and may have been covered, apologies if it's repeated, is in the lockdown. So in the lockdown and following the changes in the workplace, I have seen so many more patients coming with mechanical back and neck pain, and it is chiefly because of a very, very poor ergonomics to their work from home. So their working hours have increased like crazy, and unfortunately, most of these Indian IT workers come from very middle class or lower middle class homes, and they do not have the luxury of a proper desk. They do not have a workstation, and many of them used to actually sit on the bed with the laptop on their lap and work for hours and hours. And the cumulative effect is that we are seeing many of these people really coming with back pain. And we are still dealing with it because many companies have not gone to the workplace still, and they are working from home. And I do try to give them a few tips to try and help them come out of it. But I don't know whether this has been the observation in the United States as well. But this work from home thing has caused huge amount of a havoc with the back of this very young and active age group. Plus, they've not been active; they've been at home. So that's one of my observations.
Thank you. Actually, as to I being a microsurgeon, right from my early days of training, we were told the importance of posture and proper sitting level. Stool should be at the level, your hand rest should be at particular level, your eyes should be at particular level, and your back should be straight. So these posture, a correct posture will help you in preventing the backache, and a wrong posture and accommodation will probably add to your backache problem and a posture. So again, coming back, posture is the key for preventing backache, and a wrong posture is a key for adding to your problems. Now we move to the last question, which has come from Dr. Dubey. What about the lower back pain amongst doctors? Is there any difference between white collar workers and doctors and a laborer type of people, those who are into hard work and manual labor, in the quality and type of back pain? Is there any difference, or they are basically same?
Oh, there's more. In us surgeons, we are in such terrible posture positions for so long. Matter of fact, in preparing the presentation, I prepared a segment which I'd love to share with you just to answer that question. And so I'll share that with you right now. I'll go to my, and so in my new book, Watch Your Back, I wrote a segment and I'll read it to you. So I'll read out of my book. So the segment says, being a spine surgeon puts me at risk for spine problems. So then I wrote, as the author of our TextNeck study, I'm happy to say that we have helped the world lift its head up. But as a surgeon, I risk developing TextNeck myself. Forward head posture is a common problem. We need to perform surgeries with our hands without elevating our arms. And at the same time, we must observe closely the procedure we're performing. We can be on our feet for hours with our heads bent over or leaning in with our chins jutting. Surgeons have to pay special attention to the health of their spines. To prepare for surgery, I make sure that I sleep well the night before. I start my day with a long, hot shower. I do stretches for my neck, shoulders, arm, and legs. I do not want tension in my muscles to distract me. I find that stretching my hamstrings, especially my hamstrings, a key point before surgery, helps me to stay comfortable. I do isometric push-ups or sit-ups or lunges, and I try to stay adequately hydrated. And I watch the postural protection of my neck when I perform surgery. But certainly in the OR, we have tables that tilt and surgical loops. And so I use my program, the Watch Your Back program, to keep fit, flexible, calm, and strong. And so in specific, what I do before doing surgery, I do 100 deep belly breaths. I stretch my neck, back, hamstrings, Achilles, and right and left shoulders. I do the supination external rotation stretch I showed you. Again, I must point out that the hamstring stretches keep me in shape in surgery. And again, for strength, I do 10 push-ups or sets of 10, squatting and some lunges. And I find that I can go to a deep, low squat for helping me to charge up. And then my final thing I do is I do running in place, 30 seconds of high knees, which is your knees to your chest, 30 seconds of mid stance running, which is equal steps forward and backward, and 30 seconds of butt kicks, which are kicking your feet to your butt. And then I created a meditation series called Lift Meditations to Boost Your Back Health. I do one or two of those. And certainly my major secret is I say an amazing prayer before I operate. And thank you for the opportunity to share that daily routine that I do to protect myself as a surgeon.
Thank you. Dr. Babu, any comments on this?
Yeah. So that's what exactly the work what we have done in our short series of cases what we published in Indian Journal of Orthopedics. So we actually once, after going through Dr. Ken's article on text neck syndrome, the way he describes how much neck flexion can cause how many pounds of weight to transfer on the neck, like 10 degrees of neck flexion, 0 degrees can cause 10 pounds. And if you flex the neck up to 60 degrees, there is a 60 pounds of weight put on the neck. But most of our surgeries, whenever we observe, I will take clinical pictures of photographs while operating. All our necks are always bent extremely into looking into the wounds in the spine, especially for the spine surgeons when we are operating. We had this vague idea, why can't we analyze how much time we are actually bending our necks during surgeries? So we did a study wherein 60 surgeries we recorded. I think there is a CC camera, and then we recorded online with the surgeon's area. And then 60 tapes were analyzed with every 5 minutes breaks into photographs, converted into photographs, and then started measuring how much of the neck is flexed forwards. We did it by applying the radio reflective arrays on the tragus and on the canthus sapphire and the earlobule, and then C7 spinous process, and calculate the angles. So to surprise, the amount of time what we spend bending the necks in a surgery is quite significant compared to what we spend on a texting in a mobile. So we are as surgeons, we are all prone for this kind of problems compared to the regular population. But the physicians may be spending most of the time in sitting, but as surgeons, we spend most of the time looking for the neck. And also, if you are working on a microscope, if you are a microsurgeon working on a microscope, not in the sitting posture, if you're standing and operating, I think your plastic surgeries, most of the times you sit and operate. For a spine surgeon, as spine surgeons, we stand and operate. So we have issues with the lower back and also in the neck. And it also a problem when your assistant is taller than you, or your main surgeon is taller than you, then your operating table is adjusted to particular height, to either to the assistant or to the surgeon. Then one need to bend more to compensate or work for the things. Then we started working on that and started putting foot tables or stools and then raise the height of the individual so that you don't feel the same amount of stress while operating.
No, we have observed this also in whenever a laparoscopic surgeon or a liposuction surgeon, a lot of efforts are being put physical and the postural. And these are all professional hazards for doctors, for the surgeon. I think this is all specialty wise, but sums up that every specialty of surgeon is prone for a backache problem. Dr. Samir there? Can you go to the next question if he is not there? The question which has been asked, the role of chiropractic.
I'm there.
Yes, Samir. Your opinion, please.
I'm there.
Professional hazard.
My opinion on which one? For doctors, no, I think I have nothing to add, especially because Naresh has got evidence base, so there is nothing that I can add to that. Certainly, we doctors are guilty of not looking after ourselves. Certainly.
Yes, that is of course doctors are very poor patients and very poor followers of any advice.
Yeah.
And but definitely the back is important for every doctor for a long surgical life. Now, any comment on the use of chiropractic for supporting the postural or overcoming the postural issues? That's the last question which has been asked by the.
I think maybe Dr. Ken can answer that because chiropractors are very popular in the US.
I know. India, we don't have much of experience.
Not too many.
So American chiropractors, they operate by servicing our favorite joint, which is the facet joint. So many people, those general population, are not aware that we have these beautiful joints called facet joints. And at every level, you have these joints and they allow you motion. Any motion you have happens through the facet joints. And people are just not aware. No one told them that they have facet joints. And then if they don't use the facet joints, then they become stuck and painful. And furthermore, underneath the facet joint, the nerves exit. And so first the joint becomes stuck and painful. Then the nerve, which is exiting under the joint, becomes painful too. And so it's a really complicated situation for having stuck joints. And so now what the chiropractors do, they have either softer, harder, gentle, or forceful techniques of moving those joints. They can move it softly, or they can snap it and move it in a rapid fashion. And when they do, the joints become, they're tender for a bit, but the joints start moving again, and the joints are thankful. So American chiropractors serve hundreds of millions of treatments per year, and people love their chiropractors.
Okay, one question which has come to my mind, because we're all talking about surgeons. I believe all surgeons work under a proper conditions with a good light, with a good equipment, good height of table, and efficient assistance. And anesthetist taking care of everything else. But many of our physician colleagues work single-handedly or with a very limited sources, poor light, lots of patients sitting on them, particularly in public hospital. They're all surrounded by a number of patients. They don't have time to stand up and stretch out or do something. So what advice would you give to a physician working in a public hospital? I mean, I know all of us have been trained in a public hospital. We have worked in a public hospital. Sometimes physician has to 100 or 200 patients in a day of between 8 a.m. to 12 a.m. and there's no time to breathe. So what advice would you give to physician and junior doctor to take care of their back in an odd situation like public, not proper sitting and not proper way of examining patients? But many of the audience in this maybe general physicians or general practitioners, and they need to be informed how to take care of their back and what advice they should give to their patients also.
So I'll tackle that. So it's a process I call flash awareness. And so I think that was the importance of our TextNeck study. And so suddenly people became aware that, wow, I must keep my head up. And so as physicians, we need to love ourselves and take care of ourselves, and at all times keep our head up. And if you can't, it doesn't take much to stretch. It really doesn't. You can stretch, right? And stretch your lower back, stretch your hamstrings, stretch your arms. You can do the supination external rotation maneuver in less than 5 seconds and open up your chest. And you could do deep belly breathing all day and no one knows about it. I try to do 100 times in the morning to start me right. So breathe in through your nose, expand the lungs all the way down, your belly goes up, right? So you can take care of yourself. And our symposium is so important to bring this flash awareness to the doctor working in the situation where he's taking care of 100 people. And the fact that the doctor is aware means that he'll teach those 100 people to do the right thing.
Yes, Dr. Babu, your comments?
Yeah, I think I completely agree with what Dr. Ken has pointed out. I most of the time the doctor colleagues who visit me are, I think somehow the dentists and ophthalmologists. They are quite maybe their posture or the way they work on that or the ergonomics while they do it. I think they have a lot of issues. Coming to the physicians part, physicians, I have seen few physicians who actually serve the patients for prolonged hours. They sit and then most of the times they'll be turning, pediatricians, they used to turn to the side, one side, and there's a rotation. I've seen one very famous pediatrician in our city who has L4-5 right-sided facet arthritis. He keeps on telling me he always turns to one side, and he has been looking in that particular posture for 30, 40 years. I think that's get arthritic over a period of time. So for that, I think you need to have. I think he suggested me that he had 2 consultation tables in his own clinic next to each. So he keeps one patient in his one consultation table, and then he moves away, and then he has one more consultation table, so that he gets at least some amount of walking, getting up from the chair for some time. And also, they are looking at the X-ray lobbies for over a period of time. Every time they turn, and then when they use the stethoscopes to move on to the one side. And then these are the repeated activities which they do many decades, and they need to be cautious about this one. And then shifting the tables or having 2-3 consultation chambers and moving across the chambers is the one suggestion. Or if you are constraints about the space, then maybe you can have rotate your sitting space across and then move your spine a bit. And of course, the regular exercise what that Ken has suggested can be incorporated in daily practice.
Yeah,
Samir,
sorry, Dr. Samir, any point to add for the?
Yes, I again agree with both the speakers. And in fact, the stretches, etc., which Ken spoke about, you get the best opportunity when you get a patient, because in the guise of doing a demo for him, you end up doing the stretches yourself. So I think whenever you get a patient with neck pain, that's a good time for you to do your own stretches just to show the patient. And I think just incorporating a few postural changes in our practice would certainly make a big difference to the amount of suffering which physicians have. I agree again with Naresh. This dentist seems to be a particular problem. Both neck and back pain, cervical disc and lumbar disc. So these dentists really work in a bad fashion. The way they sit and they bend over and work is not a good way. And another group recently are the cosmetologists, who they may be skin specialists or they may just be cosmetologists. Dr. Gupta would be aware of those who do all these laser treatments and these treatments. So they themselves are, they have a lot of pain because of the positions which they are in.
I think this is professional hazards are there for the bad posture.
Yeah.
Now, my question to, I'm sure Dr. Kane must be displaying these posters in his clinical practice for visitors and patients to realize the importance of posture. Now, my question to both Babu and Samir, would you like to add these posters in your clinical display in your consulting room? The study which Dr. Kane has showed how much extra weight is added when your posture changes from 10 degrees or to 20 degrees. Do you think that will educate?
Yeah, it may help, but patients don't spend too much time in my clinic and I don't have my own. So yes, if I have a spine clinic and a waiting area, then yes. And we can at least use this to educate ourselves and then educate the patients. Give the patients tools to educate themselves. So yes.
Yes, I think it's a very important aspect of let patients study these posters and understand the importance of posture. And Dr. Babu, would you like to add into your?
Yeah. So actually, we had to thank Ken, but the way he made it so popular, patients are coming with the diagnosis of text neck syndrome. Sir, I have text neck syndrome, so I have pain in the neck and I have been such a long time and computers and this. I think he made it very popular, the term and the syndrome, and it's become a common scenario. And whenever there is, I think this annual spine days, international spine days. I think one of the major thing which everybody popularizes is the text neck. So it's like it has become a part of a regular public health awareness program for the posture maintenance. Yes, it's advisable to have a posters fixed and then everybody's clinic, so they will aware of the thing. But it has already become so popular that we don't need to do much.
Yes, thank you, Dr. Kane. Your comments now. Would you like to have some more information about the yoga and alternate therapy apart from surgery of the spine and economics of preventing surgery of the spine?
So I'd like to say I'm truly enjoying being on a symposium with Dr. Babu and Dr. Dalvi. It's I'm happy, really happy to be a part of your team. And I'm so grateful, Dr. Gupta, for you to set this up. Certainly we need to take care of ourselves, right? Certainly we need to take care of ourselves. And all three of us spine surgeons are hammering that point. You asked a new question, which is the care and the costs for spine care globally. So the frequency, first of all, has been defined by the Bill and Melinda Gates Global Burden of Disability Study. And so I don't have the exact numbers, but I believe every day in the planet, maybe 577 people, maybe 577 million people are suffering with back pain, and maybe 225 or 250 million people are suffering with neck pain. And back pain is the number one cost for global disability, and neck pain is the number 4. And so I mean, it's certainly consequential. And so there are a few, in terms of costs, there are a few estimates of costing of what the spine care cost and disability cost globally. And so we took the data that was available and we updated it with the Consumer Price Index. And our estimation shows that the global cost for spine care is between 300 to 500 billion dollars. And so the estimate is, our estimates are low. Our estimates about 0.6% of GDP. European estimates are 1 to 2% of GDP. So any which way you turn it, the cost of spine care is a lot.
So my question, which I wanted you to also, so I will rather add some more point. We all know we are going into evidence-based medicine. We are all going into the preventive aspect of medicine in the current. So if you look at the man hours lost, if you look at the insurance claim which are settled because of spine surgery, and the cost of preventive therapy like a posture, this is made compulsory or implemented on a say aggressive manner in all national health policies. Would it reduce the cost of man-hour lost and the litigations and of course litigation associated with failure and the cost of reimbursement?
Who wants to go first?
Yes.
Samir?
Amir, you want to add to this point of man-hour lost and the cost of reimbursement and the litigation?
So I think a little in India, I think I'm not sure whether they are into such complex calculations and they have to rely on our data from the West. Regarding litigation, I think we are still a little behind the United States. I don't think there is the possibility or anybody here has a sort of a class action suit or any suit against their employer for causing back pain or blame their occupation. I think we tend to blame fate and we tend to blame doctors. We don't blame employers. So I think for that point of view, I think there wouldn't be a problem. Yes, man hours lost and loss of work is definitely going to be an issue over here, as well as the cost of treating them. But again, the cost of treating them in India may be a fraction of what it is in the US, because in the US there is a tendency to do a lot of surgery, such as fusion surgery, extension fusions, etc., for the degenerative spine, which in India we don't tend to do. And the cost of surgery in India is probably less than a tenth of what the cost is in the US. So again, I think the most important thing would be human suffering and loss of working time, man hours. I think those would be the two important implications in the Indian context today. Things will change, of course, but today that's the problem.
Yeah, thank you. Dr. Babu?
Yeah, I think same, can agree with we don't see that much of workmen's compensation issues with this thing, but there are few firms where they insist for leave, extended leave, which is paid leave. So they ask us to write for the rest and then avoid work and bending forward something, so on and so forth. But yeah, it's a evolving thing, and the people are more demanding. But you can't actually objectively prove that he has no back pain unless the patient says I have back pain. You have to agree that they have to
Yes, yes.
have back pain. So there is no way that you take a serum creatinine or blood glucose test and then pain level test and then say that this particular guy has no pain or not. So we have to believe on a few of the things which are not accessible for any objective criteria.
So
So that's
I'd love to add, Samir and Naresh, while we have a population of 300 million, you have a population of 1.4 billion. And so by definition, even though you do less frequent surgery per population, you still have the 1.4 billion factor to look at. So your schedules must still be extremely busy.
I want to add one very interesting story which I have personally experienced. I was working in Norfolk, Virginia, did my fellowship in brachial plexus. And that time, the assistant to my chief filed a case against her on the complaint that she did not provide a sitting, proper sitting comfortable chair in the office. And because of that, he had developed back pain. He filed a case, appointed a lawyer, she appointed a lawyer, fought the case for 2-3 times, and then she did an out of court settlement, primarily because of the tax benefit. Because out of the court settlement, compensation are covered for the tax benefit, but it's not being charged for the tax. So, I mean, do you think this sort of thing will affect I mean, of course, we are on a different ground on a posture, but are there similar position where wrong posture can add to litigations and company lawsuit?
I'm not aware of any cases that were brought directly based on posture. I'm just not aware of any direct cases like that. But certainly every single spine case has a component of postural misalignment causing pain and degeneration.
So as a great, I think we have covered all the questions which have been asked in the panel. And any question Dr. Samira Babu wants to ask to Dr. Ken before we give a last closing remark to each of the panelists?
I mean, I could sit with Dr. Ken for hours and hours discussing back pain because it's a never-ending subject, and I'd love to pick his brains and learn more. And I'm sure over the years, over the days and years, that could happen. But I think this webinar has already been quite exhaustive for everybody. So
Yes.
we've learned a lot already. We've learned a lot today. So I need to thank him for that.
Thank you, Samir. Dr. Babu, any comment?
Yeah. So same thing as it's a new concept, and then it's more than a spine surgeon's perspective. It's taking into public health perspective. One thing I want to ask Ken before we close. I keep seeing patients who present to us with this forward neck posture and then cervical angle changes and text neck. But over a period of time, when the pain settles, they all become normal. So it's a reversible thing which we need to stress upon, and then also educate the public that it's not something which is fixed and you're going to suffer with this for the rest of your life. It can be reversed and can made normal, and then you can prevent it further to happen it again and again. Maybe there's the same experience with Ken also, I think.
Absolutely, yes. Certainly as surgeons, we have seen and they're rare, the cases with the rigid forward head posture, for which we do osteotomies and decompression and stabilization, which is a very necessary operation in those cases of rigidly forward head posture that are ankylosed and stuck. But 99.99% of people need flash awareness and postural training.
I think now closing remark by Dr. Ken. take-home message for the audience, which is a mixed audience, before we close?
So my message is simple: become aware of where your head is in space. Just become aware and watch where the head is in space. It's a gentle thing. Please do not do anything rigid, because that would be your source of pain. Gently keep your head up and expand your chest. Take a deep breath and enjoy your day.
Thank you. Sit erect and look forward.
Mhm.
Look straight. Sit erect and look straight. That's the take-home message for everyone. Thank you. Would you like to add anything, Dr. Babu or Dr. Samir?
Yeah, we look forward. That's all.
Look forward. Thank you very much.
Yeah.
Darshika, are you there?
Yes, sir. Very much here.
Darshika, now
Yeah,
you take off from me. Thank every speaker and close this.
sure, sure. Yes, sir. So I think on behalf of TalkPlexus also and the entire community who's watching us live here, we have close to 700 live viewers who are watching us here. And thank you so much, dear viewers, for all the questions. And thank you so much, Dr. Dalvi, Dr. Hansraj, and Dr. Babu. Also, a special thank you, Dr. Gupta, for moderating this session so well. Thank you so much, Dr. Samir. Even though I know it was you, I know that you are in the OT and you're still connected. Thank you so much for your time. And Dr. Hansraj and Dr. Babu for organizing the entire thing and coming up with such interesting discussions for our viewers. So with this, we'll close today's lecture, and thank you so much for joining in. Thank you so much.
Thank you. This
Okay.
is
Have a great
Bye.
evening ahead. Thank you.
the recording will be available on YouTube.
Sure, sure. Yes, sir. I'll be sharing the link shortly. Yeah.
And my